Medicaid expansion, another controversial issue. Yeah, only 2 minutes. We can get into it in questions, but expanding a government program called Medicaid is one thing. Getting individuals, poor individuals, working individuals, access to health care is another. We're all for the secondary thing. So how do we solve this situation?
Well, I think first we have to be, well, I don't know how this comes across, but we have to be satisfied, I think, with incrementally doing better in this space to some degree. I mean, first I'll say, thank goodness that it's no longer just up to the governor to expand Medicaid. I think having that before the legislature is terrific. I'd rather have 236 people duking it out over that than just one person with all the pressure that he's under, the governor's under, to expand it. I will say that we had a commission set up to look at Medicaid reform broadly. The report that came out of that group, it was almost as if they said, we don't know what's going to happen with Medicaid expansion, so we're not going to do a lot of delving into what other opportunities there are. They mentioned telemedicine as a potential for reforming just healthcare delivery in the system overall, which I think is fantastic. I saw that system demonstrated, and it's awesome what can be done remotely. But there are other things that are going on in Georgia that are terrific that just aren't known broadly. I know GPPF has written on this, but we have a charity care network in the state of Georgia that's larger than any other state. We have about 100 clinics in Georgia that are serving about 150,000 people each year. They went before the Medicaid Reform Commission and asked for $2 million. $2 million now, which that's a lot of money. But they said that they would be able to expand coverage and service primary care physician service to 100,000 more people with $2 million. Now, the estimates for uncovered, uninsured, poor individuals in the state are about 500,000. There are groups that'll go up to the $800,000 range, or 800,000 people range, but I think it's about 500,000. So we're saying with $10 million, we could extend a charity care network essentially to cover at least the primary care needs of our uninsured that would be covered under Medicaid expansion. 10 million is a lot less than the billions each year that it's projected to cost, both federal and state costs, right? And it prevents us from setting up a system that we know ultimately is going to have to be scaled back because the federal government cannot afford to continue spending the money. Now we have folks like John Kasich in Ohio that says he's simply bringing money back to the state, but that's China. That's China's money that he's bringing to the state, and Georgia does not need to be part of that. We have solutions here where we can take care of our own, and I think these are things that they need to happen, and we certainly can. We can do it.
So we're working hard, and I know GCO is too, to come up with ideas of how we can get these individuals access to health care. And I think that's incumbent upon us to make sure we're not just the party of saying, the conservatives saying no. We've got to come up with solutions. That's one thing I fought the legislature. We didn't put together a study committee to look at this issue.